each way, going down, okay? You keep everything up, all right? Work your way down, go down, like I said, 5 to 7 inches for the bifurcation. Gravity's gonna do its deal either way. Then once you're done, you gotta make sure you put the foreskin back. Otherwise, it's gonna get stuck, it's gonna get inflamed, it's gonna be very painful.
I thought you pull up to push the catheter down.
Yes, on the shaft, not on the skin.
Yeah, but when you pull up, will the skin not go with?
No. So you'll pull everything down, and then you'll hold, and then you just kind of tug the tissue up.
Okay.
You're gonna, okay, let me go back on that. The grip is gonna be a firm but not mean grip. Does that make sense? Okay, all right. Every
You know
now
how
and
to
again,
enjoy it.
some students are new nurses and stuff, and the grip is a little bit too soft. I'll just tell you that you want it to be a firm grip, okay? And you want to kind of get this done without a whole lot of manipulation, especially on young males. I mean, it's just what I'm throwing out there.
It doesn't matter the age.
Can we just put them out?
Can we just?
Well, what I'm throwing out there is every now and again. Well, I'll just skip that. Anyway, I'll land mine right there. All right, let me go ahead and get the trash can. Hey, will you pass me a trash can this way? I'm sorry. All right, so I'm coming in. Hi, Ms. Jones. My name is Justin Morgan. I'm here to put in your Foley catheter today. Have you ever had one before? Oh, yeah, I just had one last week. Oh, that's terrible. I'm sorry. I got to put another one. If you have any questions about the procedure, we're going to put this in to drain the urine out because unfortunately I'm able to avoid, and it's really important that we measure your eyes and nose at this point. No, I'm okay. All right, sounds good. And I make sure it's appropriate. I'm going to go ahead and get my assistant. Okay. Again, I recommend that everybody takes an assistant. You will have nurses and faculty say, you know, that they don't do it with a second person and that, you know, they don't have time or whatever. But I'm going to tell you, when it's protecting your license, I can find time. Foley is not an emergency thing. It's never been something where I had to stop everything. So I'm going to come in. I'm going to go ahead and raise them up to a working height because I need my back to last for 40 years. Okay. All right. You've seen inflation. You need that nurse money for the rest of your life. All right. We're going to go ahead and raise them up just a little bit so they're comfortable, right? And I'm just going to go ahead and take a quick little peek. All right. Everything looks okay, but I still want to clean them up. So I'm going to get my washcloths, get my assistant, adjust our light source if needed or whatever. You know, make sure you got patient privacy, that they don't have any allergies. You know. That you would confirm, you know, I see that you have an allergy to iodine. Oh, good thing to know. I'm not going to use the povidone iodine, right? All right, and so for your checkout purposes, they will not have an allergy to iodine. Okay. So we're going to go ahead and uncover them. And actually, for this part, I like to lay them flat. It's a little bit easier. And you're going to go ahead and drop the side rail. Okay, and we'll position everything in a few minutes. But you're just going to verbalize that you would get the light source, get the friend, you set them up, okay?
Do you need to raise the bed higher than your waist so that it does?
I will, yeah. So you're going to raise them up, okay? But this is it as far as the legs go, okay? Now, I wish I could say everybody can butterfly. They can't, okay? You got little grandmas and stuff like that, so you will read about a kind of posterior approach, right? And so that would be turn them, come around from the other side. Yeah? Don't break some little old lady's hips because she can't spread them out. We're good? Okay. So again, because we're going to be doing something sterile, it needs to be waist high. There's a side rail down. Let me scoot that away from the wall real quick. There's a side rail down. Do not let them fall. Okay. Make sure your bed is locked. Beds will roll away at the worst possible time. All right. Again, this is something where, you know, it's a modesty thing, but then you don't want to be so concerned about getting the sheets covering everything up that you contaminate your field. That makes sense? I understand the modesty thing, but at the same time, they don't want ETI. Okay. So what I was saying is you can open this up over here, or, like I already showed you guys, the other alternative is you can open it up right here, okay? So again, I would clean them up, do my hand hygiene, right? And come back with some clean gloves, or you don't have to have gloves for this part.
Can you bring the table like right here?
Yeah, you absolutely could. You could lift the table up and set it right here. Or the other option is that you could take this, and so what you'll see is sometimes nurses will set it down like this, okay? You don't really need this because you'll know what's in it. And you'll see them actually kind of roll this up and try and use it to catch trash. Okay? Now, it works, but I'm less worried about trash than I am about contaminating. So if you're okay with dropping it, that's fine too. Whatever you feel comfortable with. You get 2 weeks to practice, okay? All right, so if I wanted to do it here, this one, okay. This gets a little different than y'all's, but like I said, the top one will be tucked right there, okay? And you're gonna pull it away from you. Dig that bad boy down. I will use my arm, my elbow to hold their knee out sometimes. I do that on people too, and it's just to kind of help, and I let them know. I explain everything. If you tell them what's gonna happen, they don't get it as a surprise, okay? I'm just gonna use my elbow right here, just kind of keep your leg over, just as a reminder so you don't move, okay? I need you to stay very still at this point, okay? I'm gonna say, okay. So I'm gonna open it up away, all right? Away, and see I'm grabbing the outside 1 inch, okay? Again, stuff starts to get kind of tight. The outside 1 inch, and then you're gonna pull. Just kind of get it open like that, okay? Now, this one is a little different than your kit. I shouldn't have grabbed a different kit. Your gloves are on top. Okay, so just pause. The way your kit looks is it looks like this. Okay? All right, so at this point, if I had my table right here, I would just go ahead and let me just see. Sorry. Drop down. What's up? Got the angles from everywhere.
What's who? What?
What?
No, no, that's yeah.
Extra small? So if
So,
you need
sir,
different size gloves,
If you
tell
put
us
your,
somewhere.
sir, if you put your sterile gloves on, can you put your hands inside?
Inside?
Yeah.
Absolutely.
I thought it was just on the tip, like the first one. You just put it up here. You don't put it
On the
The
inside,
inside- the
it's
inside
it's
is-
not sterile.
The inside is touching my skin, so that's absolutely fine. Yeah,
Okay.
and if you have bigger hands or the gloves are kind of tight, I'd recommend that.
Okay. Okay. I didn't know.
Yeah, don't go on the outside. Okay. If you do need bigger gloves, we can definitely get you bigger gloves. Just if you know your size, let us know. Well, I'm available. All right. Now, again, this is going to go against my skin, but I haven't touched it yet, so it's still sterile. So I can kind of get my hands in there nice and good. Then I get my hand out of the way, or my thumb out of the way. Slide my left in, and do the Squidward thing. All right, we good? Okay. Now from here, I grab my sterile drape. The top one is going to be the full drape. Okay. The one underneath is going to be the finished straight drape. So you can take this and shiny side down. Okay. Take this and kind of drop it, and then just try and push it down into place. Now, I don't want to touch the outside 1 inch. There are some times where the video may have it where you grab it like out here, you know, with non-sterile gloves. I want you to just put your sterile gloves on from the get-go and do it kind of more like this. We good? Okay. I told you the finished straight drape with the hole. If I were to use this thing, just so that you have a visual, I would take it and set it up here. And my placement like that. We're good? You can do that, and then you can touch here if you want to, and it's absolutely fine. If you don't want to, you want to take it and throw it away, that's absolutely fine too, okay? Either way. All right. Now, I have my Povidone iodine, which we are not going to use. Your kit does not have it. We're going to ignore it. You guys have this cotton swab. Dang, I should not have gotten this kit. You guys have the swab. So open the swab sticks up, set them there. Cool? Take this, pick it up. Set it here, grab your saline, okay? Come to your port, put it on. All right, and at this time, I would even go ahead and pull this off or break it. I told you how it pulls, right? Okay, all right, so we're good there. Now, you would take your lube. I'm glad that I have this because you can see a second way. Sometimes they have a lube in a syringe. Sometimes it's a little bitty bottle, you know. You put your lube in here and it'd be ready to go, okay? 4 checkoffs. You're not gonna do that. We're gonna toss the lube. The kit that you guys have just has the silver packet. You would toss that, okay? You would grab your swab stick, but if it had cotton in the real world, if I was using this kit, okay, I wouldn't touch this, but open this up, pour it over the cotton balls. Then you would kind of separate your cotton balls a little bit. Put your lube in here, and then you'd be good to go. Does that make sense? Okay. So now I'm going to go ahead and touch you, and you're going to feel me clean. So I'm going to go ahead and touch. This hand is not contaminated. I can't move that hand until I'm done. Okay. So top to bottom, I'm going to go on the far side. Kind of throw that away. Okay. I take this one, top to bottom on the inside, throw that away. Last one, top to bottom, come down. If it closes like this, I contaminate it, I need to do it again. Does that make sense? So I make sure I get a good grip, okay? We're good here?
Yeah.
All right, cleaning is done, all right? I take this, and now for checkoffs, I would say, can you go ahead and squirt that? They would squirt it. In the real hospital, you would take this, you would dip it in your lube, and you'd go from there. And kind of bring this over. You don't want to drag it necessarily, okay? You want to have control of it. And again, hold on, I just want to make sure everybody can see. All right, urethra up top, vagina down low. If I put this in and I don't get urine return, where did I go?
In the vagina.
What am I going to do?
You're gonna leave it in and get a new kit.
Leave it where it is, and you're going to go more north. Does that make sense? So if I
You're gonna go
up, I'm gonna look for the urethra higher up from where I'm at. But I'm gonna leave this in so that I can know where I was, so I can look higher. Does that make sense?
Yeah.
Anatomically, people are not the same, okay? I have had some patients, if they've had multiple reconstructive surgeries and things like that, where it's definitely different than where I thought it was gonna be, okay?
You wouldn't have to get a new, because I guess
You would get a new kit. You would get a new
Oh,
kit.
just
but
so
it's
you
not-
say
no.
Yeah, just leave
But I
that
say,
there.
hold up, it's not really,
Yeah, because your instinct is to take it out, throw it away, start all over again. You're still gonna start all over
you
again.
don't wanna miss that hole again.
Yes. You see what I'm saying?
Yeah.
Okay. All right. So I'm just gonna do this for a second. This is just water. Okay. And that was just so I can hopefully try and slide it without the lid. All right. So I've cleaned. I've got my kit. Okay. And I'm gonna come straight in. And sometimes it takes like a little bit of a twist. It's probably not gonna do it without the twisting motion. Okay. But when I advance this thing, it's not gonna do it. Is there a bottle of spray lube anywhere? Can you pass me that alcohol, the squirt bottle of alcohol right there? Oh no, the one on the wall. Just squirt some in your hand. And, that's okay. Yeah.
If you're ever fit,
All right. So we will spray the lube on there. Okay. You cannot have too much lube. All right. So when you go, you advance and you kind of twist. Everybody likes that.
Everybody likes what?
The joke.
twist.
The twist. Yeah. When I always say you can't have too much lube, somebody always laughs. All right. So, very carefully keeping this right hand away. We will not use this mannequin because she is being mean. But you advance it. All right.
She's an older lady, she doesn't have.
She's a little bit too young. Yeah,
Gotta
we're
collapse a
gentle
little
with
bit.
that. All right. So we advance, but I make sure that my right hand does not touch skin. We're good? So I advance it to where I need to. Now, at this point, like I said, in the book, a lot of times it'll have you take your dirty hand and secure it, okay? I don't want you to do that because you contaminate the catheter at that point. So you come here, you reach over, okay? And I'm holding it in place with my hand, okay? Go ahead and inflate the balloon. I'm not meeting any resistance, so I'm okay. I pull back, I give it a little tug, it's in place. I reach over, I take it loose. From there, come over, secure it to a non-movable part on the bed, right? The sterile component is done. If I had the fenestrated drape, I just tear it off, right? Because obviously I can't work it this way. Does that make sense? Okay. So I clean up, I set them up, I go document how they tolerate it, what gauge, or what fringe or whatever, all that good stuff. I do want to show you guys when patients are walking around, we secure this to the gown. Be careful about that because sometimes people rip their gown off. You see what I'm saying? If you needed to get a urine sample, if this is brand new, urine comes flying into here, right? I could just get my urine sample from here. I could take this and go straight into my specimen cup and kind of open it up. If this has been in place and I need a urine sample, I can't do that because this has been in, right? So bacteria in the bag has been growing, right? So what I would do for a urine sample is I would clamp this off this way. I would take my lure lock syringe and put it in here, twist it in, and then I can just go ahead and get my sample here. Now, of course, I wipe this, right? Or prep first, okay? So I put it in, twist it on, and then pull up and get my urine sample that way, and then put that in. We're good there?
And so you don't have to secure it to the leg or anything?
So you should, and I'm actually gonna get a stat lock and show you, there's a sticker that goes on here, and it clamps this thing. They're like $5 a piece, so I didn't want to have all y'all buy one. I'm gonna buy one, or I have one. I'm gonna put it on and show you how it works. But it'll secure it right here, but you do not want it to be tight, right? Think about stuff, people move, things move, okay? Give it some slack. Go over or under, which one do we do? Over, okay? You don't want it to have dependent loops, right? So you don't want it to be like sitting there like this and where urine is sitting here and it's having trouble getting over gravity. So you want to make sure that it's kind of stretched out a little bit. If you do see the dependent loops, go ahead and let it kind of go or reposition the patient. But you kind of want the patient to lay down, yeah?
And everything's gonna be good with that bag, right? Because like when you do IVs, you have to make sure your clamps close or flow through.
Yeah,
right?
so the bag is gonna come just like this, okay? Now, when you want to empty this thing into like a urinal or something to just empty it, okay? You would take this loose, these little wings clip, okay? So you take this loose, put that in your urinal, and then you unclip here, it'll flow out, okay, gravity-wise. You can measure on the bag, but the problem is the bag moves, so it's not very accurate. So when you're like in the ICU setting or pretty much everywhere, you should be putting this into a urinal and actually measuring it and then like doing it eye level and then dumping it. There are times where you got to do a protein, right? You guys know about that yet? Okay, or creatinine clearance. How long do we keep the urine? Come on.
After
What'd you say?
1 hour.
Oh,
24 hours?
24 hours,
It
yeah.
starts growing bacteria. Right?
Yeah, so we might have a creatinine clearance that's like a spot one, or it might be a 24-hour one. The 24-hour one, they usually got to keep the urine on ice, okay? So you have these big jugs that you're pouring this into. You'll have like one of those pink wash basins, you know, filled up with ice just to keep it cold. Sound good? Okay, all right. To remove this thing, okay, so I put it in, it's in for a month, everything's good. And again, like I said, I do this on checkoffs with your checkoffs. You're gonna go through all the steps, put it down, you're gonna raise the head of the bed, raise the side rail up, lower them down, you're gonna document what it looked like, how the patient tolerated, how many insertion attempts, you know, all that good stuff, okay? Because they might have, it's very different if you put a Foley in and somebody puts out 100 cc's of urine versus they put out 2 liters, right? Or if it's dark red versus clear, you know? All right, so it's been in, I document all this stuff, and then I'm gonna tell my faculty if this is a male patient, I would go ahead and retract the foreskin. If they were not circumcised, I would clean from the urethra meatus, working my way down, concentric circles, one circle with each swab or cotton ball or whatever, right? Holding the shaft up at 9 degrees, go in, 5 to 7 inches worth of bifurcation, go ahead and inflate the balloon, pull tight, go ahead and let everything rest, replace the foreskin to where it was, and then I would go ahead and document. And they'll say, sounds great. Okay, now, if you're removing this thing, you come in here, put your syringe, you say, hey, I'm here to remove it, you know. You could take one of those chuck pads if you want to, okay? Set it down here so that everything falls into your chuck pad. So, the very first thing you're gonna do, the very first thing you're gonna do is you're gonna empty the Foley bag, right? Like, why do this with 2 liters of fluid in there? Empty it out to where it's completely empty. Set your chuck pad down, tell them you're gonna remove it, tell them take a deep breath, kind of deal. Whenever you go, you insert it, it'll passively flow. I still kind of do a little pullback just to make sure I got it all. I give a nice little tug to make sure there's not a whole lot. There may be some resistance because it's been sitting in there for a week or so, you know, but not a ton of resistance, right? And then just one smooth, go ahead and blow out for me like you're blowing out a candle. Thank you, right? Take it like this and trash, okay? We're good? Easy enough.
And then pericare?
You can do pericare afterwards, absolutely. And then once you remove a Foley catheter, what do you need to tell the patient?
They should void within 6 to 8 hours.
And if they do not void within 6 to 8 hours,
Then you need to call the healthcare provider.
you're probably gonna have to cath you again. You know, sometimes they may not. You just tell them, I may have to put one back in. And they say, you know what, let me try. And then they're able to kind of strain and get it to go. Is it gonna be uncomfortable when they have a Foley catheter in? Are they gonna have a burning sensation?
They shouldn't.
You should not have a burning sensation. You probably will, especially if it's a first catheter. But it can just be from the trauma of the urethra or the catheter going in. A lot of times it's if we use too big a one. And then that first void afterwards will probably stink. You know, I'm just gonna be honest. I don't tell them that, but if they come to me and they say, "Oh my God, that burned afterwards," and I don't get overly excited about it. Now, if they say over and over again that they have a lot of burning when urination, then we need to look into that and get a UA. You know, there could potentially be a little bit of blood. Again, that's if we use a catheter that's too big, or if a guy had benign prostatic hypertrophy and we shoved it. Right, that could happen. We should not see frank blood, and sometimes blood in a Foley catheter could let us know that a UTI is developing. Right, so that'd be another thing to watch out for. Eyes and nose. How much urine output should we have?
3 milliliters an hour.
Minimum of 30 mLs per hour. Okay, it's really half a cc per kilogram of ideal body weight. So that changes things when you're talking about pediatrics. It changes things when you're talking about Yao Ming versus my grandma at 4'11", right? Yao Ming should be having like 40 or 50 cc's, right? And so if he's not, then we know something's going on. Comments, questions, concerns? I'm gonna show you all the stat lock. Is everybody else okay?
So we just secured just one?
You're gonna secure it, yeah, with stat lock, and then you put it on a